555. You can send in questions, cases, and related contributions on social media, Facebook, Twitter, and Instagram at WFM917. Text and WhatsApp to 070 317 56537. You can listen live online on www.wfm917.com. Radio Doctor, Nigeria's first free consultation radio health program on WFM 91.7.
Hello, 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 hello. Good morning. Good morning, my neighbors. Good morning. How you doing? Hope you are fine, doing well. Time check, it is 8 minutes past 10 this fine Tuesday morning, the 28th of October, 2025. We are literally in the home run. Like I said this morning during the breakfast show of October, actually, we're in the home run of 2025. Because once we entered November, boom, it's all over. But you're tuned into WFM, Women Radio 91.7, Nigeria's first and only radio station for women and their families. This is Radio Doctor, your free health consultation program where real doctors advise real people. This is Radio Doctor, which is Nigeria's first specialized radio health program where medical doctors consult for free and advise on radio on your Women Radio 91.7. Radio Doctor is broadcast Mondays through Fridays, 10 a.m. to 11 a.m. My name is Fumi Bangbala, and our Radio Doctor today is Dr. Ewanawa Temidire, who is the Senior Registrar in Obstetrics and Gynecology at Lagos Island Maternity Hospital. He's also the first Vice Chairman, Nigeria Medical Association, Lagos State. Good morning, Dr. Ewanawa.
Good morning, my dear sister, and good morning, Nigerians. I'm glad to be on here.
Yeah, it's been a while. How have you been? Glad to have you back on the show.
Thank you very much. Actually, I've not been around, but I'm back now. Thank you.
Okay. It's good to see you. Thank you so much for coming. All right. Radio Doctor today, Dr. Ewanawa will be consulting and advising on irregular periods. When should we worry? When should we not worry? Actually, we should worry. And when you should not worry. The phone lines will be open shortly. 07000-917-917, 09155-917-917. If you want to text us, it is 08155-917-917 or 0703-1756-537. The toll-free line is back, so you can call us for free on 0800-1235-917. As always, you can listen to us live from any part of the world you find yourself, www.wfm917.com, Twitter or Facebook or Instagram, WFM917. Okay, let us get into it. Irregular periods, when to worry. Dr. Ewanawa, what exactly is considered an irregular period? And can you give us an example that a listener can relate to?
All right, thank you very much. And once again, good morning, Nigerians, and all of them, everyone across the world. Thank you. Now, irregular period. Thank you very much. Now, the irregular period really has some will look at it, but by standard, it should have a standard definition, and by that, we are looking at best practices of gynecology and all of those things. So, by definition, irregular period is what people refer to as menstrual irregularity. Is actually a period is said to be irregular when you now talk about a menstrual cycle that do not occur at regular intervals. So, in other words, the time between the start of one period and the next one actually varies significantly from one cycle to the other. Now, let us place it side by side with a normal cycle so that it can make sense to some people here. Okay. Because if you look at a normal menstrual cycle, there are some things you look at for before you say a cycle is normal. You want to look at the length of the cycle and want to look at the duration of flow. Now, the menstrual cycle, for example, will say that, it's 28 weeks, it's 28 days plus or minus 7 days. By that, you say 21 to 35 days. Because if you say 28 days plus or minus 7 days, that is simply you take 7 from 28 and you add 7 to 20. That would be 27 to 31 days. That would be the normal cycle length, or what we consider the normal cycle length, 21 to 35 days. Also, the flow of menstruation can actually be for 2 to 7 days. The flow of menstrual flow should not be less than 2 days, and
Yeah.
it should not be more than 7 days. So once you have this, you actually see it is actually normal. That is why you see a normal um, menstrual cycle. So, for example, now if a woman, for example, has maybe in January, in December, for example, she had between when November and then December, it took her 26 days to see her period, and by the time she's seeing her period in probably January the next year, it's taking her about 45 days. All right, and by the time she's
Mm-hmm.
seeing it February the next year, she's taking her almost about 20 days. Okay, you can see that the first time 26 days, the other one 46 days, the other one 22 days. You're like, what exactly is happening? Because the variation is really so much. Because really, what you expect is that if a period is going to come, if it's going to come a bit earlier, it should be between 7 to 9 days. And if it's going to come much later, it shouldn't be more than that 7 to 9 days. Minimum of 7 days and maximum of 9 days. Once it's going beyond that, in terms of when it comes and how it came earlier, so it means that that period is actually considered to be irregular. And for
Mm-hmm.
those that have that period, it's not something that doesn't happen just like that. Like rightly mentioned at the start of this program, that when should a woman be worried? That really a woman should be worried. Yes, a woman should be worried, really,
Yeah.
because some conditions can actually be responsible for this. I just mentioned that briefly before we go into the meat. Some endocrine gynecological conditions like what you call polycystic ovarian syndrome, which is considered to be the commonest endocrine gynecological problem, and in fact, the leading cause of anovulation in women. About 70% of women that actually have anovulation is actually due to polycystic ovarian syndrome. It can even be because of thyroid problem. Maybe someone is having hypothyroidism or hyperthyroidism. All of these things can affect the higher center that controls the menstruation, and even can even be that women that have what you call hyperprolactinemia, that is high level of prolactin in the blood. All of those things can be responsible for this, or women that have some long-standing medical conditions like diabetes, or a woman that decided not to eat because she wants to maintain a particular body weight, and all of those things. All of
Yeah.
those can contribute. Thank you.
All right. Thank you so much for that exhaustive response. A lot of people actually do not know what the cycle of their periods. So that was really, really good. Okay. For many women, they think that if their period doesn't come on the exact same day every month, it's irregular. Is that true? Should periods come on the exact same day every month? And is that tantamount to being irregular?
All right, thank you very much. Yeah, that's a very good question. Now, period does not necessarily have to come on the exact dates, because if we look at the month
Yeah.
also, the month has different number of days.
Yeah.
Some months have 28 days, some have 39 days, depending on whether we have a leap year that year, and some even 30 days, some 31 days. So the period can definitely not come the exact date. It will not come the exact date. You understand? But because, like I said, different months have a different date. Okay. So the important thing is that a cycle is actually considered regular. There are some things that you see for you to now say that, oh, this cycle is actually regular. It doesn't matter whether it comes on exact day or not, and it's unlikely to come on exact date. The reason being that we just said it now, that different months have different number of days. So it's unlikely for you to have it. And what are those things that make you say, oh, this cycle is actually regular? And let me just be relaxed that this cycle is actually regular. The first thing is that, what is the length of the cycle? Remember, we mentioned this not quite long, that the length of the cycle is actually 28 days plus or minus 7 days. So the implication is that for every cycle that is considered normal, it must be between 21 to 35 days. That's normal. So if a cycle length, for example, is not less than 21 and is not more than 35, is
Yeah.
actually considered normal. We should have that at the back of our mind. On the other hand, again, if you had seen your period earlier, maybe a month before now, and now you are seeing your period, and the period is having maybe delay, it's not coming at the date you are expecting, but the date the period actually came is not more than 7 days less than when you are expecting it. It is normal. Or it's not even more than 9 days than the date that you're expecting it. It is normal. Or
Mm-hmm.
even when you have delay, for example, and you're like, oh, I should have seen my period. Could it be that I'm period and I'm pregnant and all of those things? Just hold on a bit. If that delay is actually no more than 7 to 9 days, or some would say 7 to 8 days, it is still irregular. It's still regular. There's no problem with that. It is when it has now gone beyond that They will not start saying, oh, probably this is an irregular period and what I feel. But the bottom line is that we must know our cycle length, and we must know what we consider a delay. Let me use the word relatively. If it is not more than 7 days, okay, or 9 days, it is still not, it's not abnormal. So, but the bottom line is that you really don't expect to see your period at a particular expected date, because the number of days in a month are not the same.
Are not the same. Good. Okay, what are some of the causes, some common causes of irregular periods? You sort of like mentioned them when we started, but what are the more common causes of irregular periods in women?
Okay, thank you very much. Now, to look at the causes of why a woman can have irregular period, there's some things that we have at the back of our mind. What are those things that we can have at the back of our mind? Can a woman normally have an irregular period? The answer is yes. A woman can normally have an irregular period. Can a woman have an irregular period that is actually abnormal? Very true. A woman can have an irregular period that is abnormal. If there's an underlying medical condition for that, she will have it. But what about, let's talk about the first one first, which of course is women that can have irregular period and yet it is normal. For example, puberty, when a woman in puberty, you are looking at menarche. Menarche is the onset of menstrual flow in a female. That's menarche. All right. Now, if you look at this menarche, which of course is the onset of menstruation in that female, it has a particular tree, so to say, or axis that controls, the menstruation and all of those things. Now, that axis is what we refer to as the HPO axis. That is hypothalamus pituitary ovarian axis. In other words, you're having two things in the brain there: the hypothalamus, the pituitary gland, and of course, you are having the ovary down in the abdomen. Now, all of this, they communicate effectively. It is the effective communication that explains the menstruation of every woman. So if there's any problem along that axis, along that pathway, it's going to affect the menstruation of the woman, i.e., whether it's going to be regular now or irregular. But let's quickly break this down again. For someone that got into menarche, that just started their menstruation, now it takes a while for the hypothalamus to actually mature, because the hypothalamus is going to mature over time, usually between 1 to 2 years. So if a lady just started her period newly, you don't expect it to be regular until like a year or 3 after she starts. That is when you expect it to be regular, because the hypothalamus that is involved in the production of this, or what the hormones called the gonadotropin-releasing hormones, that will in turn act on another gland known as the pituitary gland, that will in turn act on another gland known as the gonads, would take a while, a year or 3, to mature effectively and be able to regulate the menstruation for that lady. So in other words, this can actually be normal. The other thing that can be normal that I can see here again that can cause a regular menstrual cycle is actually a woman that is actually perimenopausal. A woman that is around 40 years or thereabouts. Peri means around. That means she's close to menopause. We say menopause really has to start from maybe 50 plus or minus 5. And that's probably 45 to 55. So any woman around 40 years of age is actually peri. Peri means around. So that means she's around the menopause. Now, if she's around the menopause, and in view of the age of the woman, the quality of the egg is already affected. In fact, once a woman is even 38 years and above, the quality of her egg is already affected. In about 50% of cases, the quality of egg is already affected. Now, what determines your menstruation and how regular it is the quality of egg that you have. Because these eggs are going to produce two very important hormones, the estrogen and the progesterone. The estrogen plays a role in the repair of the wall of the uterus. But of course, progesterone, that is when the endometrium will now be shed, and what is referred to as menstruation. Imagine the ovary that does not have good quality. You cannot give what you don't have. Imagine the ovary that does not, the ovum that does not have good quality and is now producing estrogen and progesterone. It's going to affect the function, and one of the function is menstruation. So for a woman that is close to menopause and is having irregular menstrual flow, is not out of place in view of her age. Or the other thing you can look at again and say, oh, this may actually be normal as well. A woman that is, for example, she's breastfeeding, she's put to bed, she's breastfeeding, because she's breastfeeding, remember that prolactin is going to be very high because of the production of milk. And when the prolactin level is very high, it has an effect on ovulation.
Mm-hmm.
And anything that affects ovulation, and that's why I say that for women that are breastfeeding, they are almost always protected against pregnancy. And that's what we call lactational amenorrhea. So imagine a woman that is breastfeeding, has high level of prolactin, she's not ovulating. When she's not ovulating, her period is going to be affected, and that will be irregular. So these three things we've talked about, i.e., menarche, as in puberty, perimenopausal,
Mm-hmm.
breastfeeding, they are all normal.
Yeah.
All right. But most importantly, again, you can have other causes. Other causes are the ones that they should give us a lot of concern.
Okay.
Now, what are these ones that give us a lot of concern here? For example, we talked about polycystic ovarian syndrome. Like the
Yeah.
name suggests, poly means plenty. Cystic means you have like fluid collection. Ovarian within the ovary. So you have plenty fluid-like collection within the ovary. So that is polycystic ovarian syndrome. For most women that are not even ovulating, evidence has shown that about 70% of them, the reason why they're having problems with ovulation is because they have polycystic ovarian syndrome, which
Mm-hmm.
is PCOS, all right?
Yeah.
Which is PCOS.
PCOS,
And
yes.
usually, yes, PCOS, yes, it's very common. And usually what you see in PCOS is that the male hormones, which is the androgens,
Okay.
what we may refer to as testosterone, is
Mm-hmm.
actually very high in the female's circulation. That is testosterone.
Okay.
In addition, so in other words, you're having male hormones now in the body of the female. So the other thing you can have there is actually what we call insulin resistance. Insulin usually has a role to play, but for them that has PCOS, there is insulin resistance in them. And that's why I say that for those of them that actually have polycystic ovarian syndrome, in fact, about 75% of these women, what happens is that it's either they don't see their period at all, or their period is irregular. And in fact, for about 75% of them also, they don't even get pregnant. They don't even know pregnancy
Yeah.
because there's no ovulation. There has to be ovulation before you talk about pregnancy. So in about 75% of them, they don't ovulate. There's an ovulation in about 75% of them. And even for those that will eventually get pregnant, about 50 to 60% of them will actually have recurrent miscarriage, which is pregnancy loss. And in about 40% of them, they're on the big side. And of course, when they're on the big side, your guess is as good as mine in terms of what can happen with respect to hormone production and all of those things. They're actually on the big side, where some hormones are now get converted into estrogen. For example, the androgens gets converted into the estrogen by a process called aromatization. And we have plenty of estrogen in circulation, it has its own effect also on the endometrium. And of course, this woman will not be able to ovulate eventually. So that is polycystic ovarian syndrome. So another problem you can actually see here that our endocrine problem is the high level of prolactin. High level of prolactin actually has a role to play here. Now, this high level of prolactin, it can come from anywhere, but most times it can be from some tumor in the brain, that is prolactinoma, and once you have this, and there is a hyperprolactinemia, it will ultimately affect ovulation, and that will affect the human menstruation. So other endocrine problems you can have is that of the thyroid disorders. The thyroid disorder can be that either the thyroid is overacting, which is hyperthyroidism, or the thyroid is working suboptimally, and that is hypothyroidism. So all of this also can play a role, in affecting the menstruation of the regularity of the woman's menstruation. So other things you can see here will now be for people that has a premature ovarian insufficiency, and this can be due to anything. Maybe chemotherapy, maybe genetic, because of the family, maybe it runs in the family, genetic problem, or chemotherapy, as the case may be. So all of this can as well cause the woman to have regular menstrual period. But other things that we can just talk about briefly, which is very common in this part of the world, are structural causes. For example, if a woman has fibroid, because women that are of reproductive age, about 20 to 7% of them have this fibroid in their womb, and of course, yes, and of course, in more than 50% of them, they don't have symptoms. But for those that have symptoms, majority of them, the symptoms they have is that of irregular bleeding heavy bleeding, and
Mm.
what have you. So one of the things that can actually cause a period to actually be irregular also, in addition to the one that we have talked about, is actually, structural problems like a woman having fibroid in her womb. That can actually make her to have irregular bleeding as well. So I just felt as just mentioned this. But lastly, also, you cannot end this without talking about some drugs, some medications have also been shown to make a woman to have irregular menstrual flow. And these medications can actually be drugs that will take for depression, the antidepressants, or those that have maybe epilepsy, for example, the antipsychotic, even antipsychotic drug also has been shown, and even chemotherapy drugs also have been shown to play a role to cause irregular menstrual flow in females. Thank you.
Wow, women are really going through a lot. So you had talked about ovulation, how when some of these symptoms or causes come ovulation. So obviously, let me rephrase it again. How can irregular periods affect fertility or even chances of getting pregnant? Because you had mentioned some of them that affect ovulation. I think it was hyperprolactinemia you had mentioned, and PCOS.
Yeah.
You're not ovulating, and that's when you. So obviously it affects your fertility. But then the question really is, how can these irregular periods affect fertility? How can they affect chances of getting pregnant? Because really, every woman, once she starts seeing that, oh, there's something wrong, she begins to worry about the fact that, oh, won't I be able to have a child? Would I be able to have a child? And all of that. Yes, please.
All right, thank you very much. Yes, you like rightly mentioned that how can this menstrual irregularity actually affect infertility? Yes, it can actually do this in so many ways. Like we're trying to even point out some. For example, now most of these problems that actually occurs when the woman has irregular messes. The first thing is to establish what is causing this irregular menstruation. Because once you know what is causing the irregular menstruation, you will know, oh, is this abnormal? Is this normal? Now, usually for the abnormal causes of menstrual irregularity, again, a good number of them, for those, just a minute, sorry, for those that is causing irregular menstrual flow and that are actually the abnormal causes, ultimately what they do is that they're going to affect fertility. How are they going to do that? Now, remember we said, for example, if one has irregular menstrual flow, and that irregular menstrual flow is as a result of maybe an endocrine condition like the polycystic ovarian syndrome. Remember we said that for those that have polycystic ovarian syndrome, that is PCOS, in about 75% of them, they're going to have problem with fertility. Now, this is what actually happen. In the case of PCOS, for example, the woman has enough. She's not ovulating because how she's not ovulating, there's so much male hormone androgen, that's testosterone, and also you have insulin resistance. And at the end of the day, now all of this is now affecting the axis we talked about not quite long. That is the hypothalamus, the pituitary, and ultimately affecting the ovary. So invariably, what that now happens is that the woman will not be able to ovulate. And because the woman is not ovulating, of course, the precondition for pregnancy to start with is actually ovulation. So because she's not ovulating, and the woman will not get pregnant. And that has affected, fertility. That is one. Secondly, a woman whose period is actually irregular, because one of the things that you have to do is that for every woman that runs a cycle, you must know her fertile period. It is a fertile period that you will calculate, it's a fertile period that you will know, and that's what we call timed intercourse. Such that when the woman is in her fertile period, that is the time to meet with the spouse and try pregnancy. Imagine a period whose period is actually irregular. The question to now ask is, when is her fertile period? When is the period that she has the highest chance of conceiving, of getting pregnant? That would be a very important one in view of the irregularity of her period. I don't know if that is clear enough.
Yeah, that's clear.
Yeah.
Yes, I perfectly understand that. Yes. So what are some practical tips that's maybe for women to maintain a healthy menstrual cycle? I mean, for the ones with maybe fibroids or hyperthyroidism, Yes,
Yeah.
or hypo, or the hypo one, or even those with PCOS. I suppose that's another. I think we should start with that. That's another conversation entirely. Is it possible for women with these issues to have healthy menstrual periods, or is it that they will have to be on some kind of treatment to be able to help them be fertile?
Now, for a woman that has, can I take the question again? Take it again, sorry.
So for women, because the question I really want to ask is, what are the practical tips for women to maintain a healthy menstrual cycle? But the this question can sort of like segregate, exclude women who don't have regular cycles, women that probably have
Okay.
hyperthyroidism, women that probably have PCOS, women that have fibroids, right? How is there anything, is there any treatment that's going to help them get back their periods regularly, or do they have to go through maybe a surgery and things like that? Is there anything that can help them get back their menstrual cycle?
All right, thank you very much. Getting back the menstrual cycle, like rightly, like trying to ask that those, practical tips that can help them maintain the healthy menstrual cycle. Is that correct?
Yes.
Okay. Now, again, the intervention you will institute for that woman will depend on what is actually causing it. Remember, we said that the cause for this can actually be normal, so to say, if you are dealing with those that are perimenopausal, those that just started their menstrual flow, as in those with menarche, or those that are actually breastfeeding, because of what we call lactational amenorrhea, considered to be normal, those three. Or those that has underlying pathologies or abnormalities, like those that have PCOS, thyroid
Mhm.
problem, those that have stress, eating disorder, overweight, and all of those things. The first thing will now be to first identify what is causing this problem. Even if it is a structural problem, for example, maybe uterine fibroid, for example, if it's a structural one, you must identify it. That's the first thing to do. But I haven't said that, for example, if you notice that, this woman is actually has her weight appears to be on the small side,
Mhm.
and obviously this is actually affecting the axis we talked about, which is the
Mhm.
hypothalamus, the pituitary glands, and then by extension gets into the gonads, which are the ovaries. Now, if you notice this, that what we're seeing here is actually underweight. One of the things that I want to do for this woman is to ensure that she maintains a very good diet, a balanced diet. All right. If, for example, the reason why she's having that way, because one of the things that we do for them is that when we see them, you ask them questions, you examine them, you run some investigation, you come to a conclusion that this is what is wrong with this woman, and this is what I'm
Mhm.
treating her for. It's on the
Mhm.
basis of that I cannot say, oh, this is exactly what I'm treating. So after you have, let us assume you have done all that, you've seen her, you've asked her a couple of questions, what you call history taking, you've done a general examination, you've requested for investigations from the lab, you made up your diagnosis. At that point, you now institute your treatment based on your clinical assessment or findings of that patient. If, for example, one of the findings is that, oh, the weight of this man seems to be on the low side. So one of the things I want to do for her is to ensure that she improves on her diet or dietary modification. Which is, in fact, in most cases, we even have to co-manage with a dietitian, where she has to say, dietitian, so that she can eat, what is expected of her, variety of fruits, maybe vegetables, and what have you,
Mhm.
including some supplements. We even have to even be on some, supplements also, and like you said, modification of, dietary modification. All those things that she's trying to avoid because she's trying to put on a particular weight, we tell her to go back to those things and start eating those things so that she can maintain that weight, because that weight is actually very, very important. Now, if she's now engaged in a lot of exercise, for example, where she lost so much weight because of fitness and all of those things, some of those things that I would do for her is to moderate exercise and
Yeah.
be sure that whatever exercise she's doing is of a moderate one and all of those things. So that's another practical way of going about it. Now, for the other issue that can actually contribute again, that we know can contribute if you take a very good history, for example, that is there anything to suggest that this woman is stressed, physical stress, stress from activities, stress from work, and all of those. Because with this stress, they're supposed to release certain hormones, and those hormones they release, like the cortisol, for example, the adrenaline and all of those hormones actually act on the higher center. So it is those stress that we now help them to see how we can manage and those stress for them. And for those of them that have actually not been sleeping, of course, they need to get good and sound sleep, and that will, assist them a lot. And very importantly, also, they must see their gynecologist. It's actually very important to see their gynecologist because, like I said before, if, for example, the reason why they are having that irregular menstrual flow, for example, is due to maybe a structural cause, like maybe uterine fibroid, a cervical polyps, and endometrial polyps, the correction for that is simply surgical. Surgical in the sense that you have to see the gynecologist will have to work them up electively for a procedure, depending on what the doctor or the gynecologist has identified as the structural cause of that irregular menstrual flow. For example, if it's due to cervical polyps, so a polypectomy will have to be performed on her, and if it's due to a uterine fibroid, for example, a mammectomy will have to be performed so as to correct the irregular menstrual flow. So the practical tip would just be the findings on the history taking, on the examination findings, on the investigation requested
Yeah.
for, and of course the diagnosis the doctor has made, and that will form the basis for the treatment. And with this, we will get practical tips on how to have a healthy or how to
Menstrual
restore
cycle.
a menstrual cycle.
Okay. Now, there's some women who do not, thank you so much for that, sir. There's some women who do not even know how to track their menstrual cycle. They've heard you speak on the first one, they've heard you speak on the, respond the first question, the second question, and they still don't know. How, like, is there I remember the first time I went for, was it antenatal? Yes. And I remember that the doctor just did one very funny kind of calculation. And I was just like, it was like math. And because of me, I just use my app. They say I was like trying to figure out, okay, when was it? I just go on one of these, period apps, and I just checked, oh, when was my last period? How many weeks pregnant am I? And all of that. There's some women who don't know. Even if you ask them to go on the app, they don't even know. Even if it's to calculate how many days their period was for, whether it was 3 days or 5 days, how much more what their cycle is. Some people is 28 days, like you said, some people 35 days, right? Is there a basic way? Is there a basic, really simple way to teach women how to track their menstrual cycle? Or are there signs that they should pay attention to? In one of the radio doctor with one of the doctors last week or 2 weeks ago, I literally told the doctor that I remember when I started noticing signs, and even the signs is not even all the signs that I know. But so are there signs that they should pay attention to? Is there a simple way to calculate their menstrual cycle? Are there apps? Are there tools that you can recommend for them? Yeah.
Okay, we're talking about menstrual cycle and not ovulation. Let me get that clear.
Yes. Is it not the person that knows their menstrual cycle that will be able to calculate the ovulation?
Yeah, I got that. Now, let me just break it down this way. Like I said, for women that have irregular menstrual period or menstrual irregularity, one of the issues surrounding that is the fact that such women might have issues at conceiving, because one, the condition itself, if it's a pathological one, it will affect ovulation, and if it does affect ovulation, the woman will not be able to get pregnant on time. She will have issues with fertility. And in addition to that, for those that it's just that it is actually irregular. So what that simply means is that if we are not able to calculate for them when they are actually ovulating, in spite of the fact that they are even menstruating, not mind whether it's actually an irregular menstrual flow, such women will end up not getting pregnant. Okay,
Yeah.
but the way to think about it is this: the first thing is this. Now, for a woman that's probably you have calculated her period maybe in the last 3 months, for example, and you have an idea of, oh, this woman period is every 26 days, for example. Now, the way we do this is that you have the luteal phase, you have the proliferative phase. Now, for the luteal phase, for example, it's always 14 days. Now, because it's 14 days, what you do is that just divide it into two. If it's 20-day cycle, now in order to make it A and B, the first part will be 12 days, and the second part will be 14 days. That makes it 26. And for a woman that runs a 20-day cycle, for example, the first part will be 14, the second part will be 28. It will be 14 as well, sorry.
Yeah.
While for a woman that actually runs 21-day cycle, the first part will be 7 and the second part will be 14. I hope that is clear to that point.
Yeah, yeah.
Now, if, for example, a woman maybe has 26-day cycle, for example, and the 22-day cycle she runs, for example, and we are saying that it is 12 and 14. So that means 14 on the other side is actually constant. Remember that the sperm takes about 2 to 3 days in the woman's body, 2 to 3 days, that is 42 hours. So usually we say that by day 12, we expect that woman to ovulate on day 12. So by the time the woman is around day 10 of her period, in view of the lifespan of the sperm, which is actually 2 to 3 days, she can actually meet with her husband from day 10, not necessarily wait day 12, because the sperm will still be there to wait
Yes.
till day 12 that she's going to ovulate,
Yes.
instead of waiting till day 12. I hope that is clear.
100%, yes.
Okay, so that is what we actually expect from them. That is one. Secondly, again, of course, there are, like we're trying to point out there, you could have some of this app online for menstruation and all of those things. And usually, what we tell them is that once of course, most of them go online to pick the app. When they pick the app, we see them in the gynecological clinic. What we normally do is that we will just ask questions around their menstrual period, usually in the last 3 months, and we'll help them calculate it and see whether it tallies with that of the app they are actually using that they're able to get online. Because the truth of the matter is that you still have to see the gynecologist to help you still calculate it, and so that at the end of the day, you don't miss that period. But most times, the difference in what they got from the app and what we calculate from our own calculation based on the gynae history is about a day or two. Interval, just a day or two. The difference is just about a day or two. But the most important thing is that no minding whether or not they have access to an app, they still have to see their gynecologist so that the gynecologist can help them calculate. And of course, the gynecologist, the responsibility of the gynecologist to take time to explain to the woman how he got this and why he's doing it that way. So that both of them can be on the same page. That is the essence. So that both the doctor, the gynecologist, and the patient
Yeah.
can be on the same page. So I think that's my contribution, and that's what I want to say to that.
All right. Okay. For women who may feel anxious, maybe embarrassed about their irregular periods, how can they overcome fear? How can they feel confident also about seeking for help from, medical practitioners?
I didn't get that again. You said some women that may do what?
Who have been feeling anxious, who have been feeling embarrassed about their irregular periods, they're like, it's not coming. What message would you like to share with them? How can they overcome this fear? How can they feel confident about seeking help? Because most times women just feel like women feel like, oh, they are what's the English, they are not woman enough. So is there any word you have for them to say, okay, look, be confident, go and ask for help, it is for your good?
All right, thank you very much. Well, I think as gynecologists and as women doctor, the happiness of the woman is always the priority of every gynecologist. And of course, when we see them in the gynecology clinic, most times we engage them very well so as to get some information from them. Now, for some women that have this menstrual irregularity and who probably felt that, oh, how do I go about this and all of those things, and they don't feel ashamed, usually what we tell them is that they are not alone in all of these things. Of course, that is why you have come to see a gynecologist. And there's nothing to be ashamed of. There's nothing to be worried about. Having issues with menstruation is actually, common cases we see in the gynecological outpatient department. And we let them know that these are things that we see commonly, and these are normal things that we see. Irregular period is so common. And we let them know all that. And of course, when we tell them that also, we let them know in so many ways that, look, once a woman has irregular period, it should not be seen or interpreted to me a sign of weakness or faults, or blame on her part. No, it should just simply be seen as a sign of, let me seek for the support, the assistance of the gynecologist. So just a way of telling you that you should see the gynecologist. So it's not any fault of yours in any way. As when they come to us, how we just ensure that they overcome this fear. And that we educate is by by education. Understand? The knowledge given to them, and the knowledge they acquire also will help them reduce that anxiety and of course, it gives a better communication between us and them. And but other thing that we also do also is that before even seeing a doctor, once they have this, if they have some trusted friends around or some family members who obviously would have gone through this before, or probably would have seen a gynecologist in the past before, the first thing they can do is to actually discuss with that person first. It can be a trusted friend, it can be some family members, it can even be online where you want to ask some questions, start from there. After you have discussed this with them and you're able to get some information from them, that to a very large extent will assist you that no, it is actually not a shame to have menstrual anxiety. It's a common thing that is seen in gynecological clinic. But more importantly, they must have a doctor and of course, preferably a gynecologist. Okay, where they can actually see them. Because what the gynecologist is going to do actually is to welcome them warmly and then begin to educate them and tell more about menstrual irregularities. Remember at the beginning of this discussion, we talked about irregular menstrual flow. Are they normal? Are they abnormal? Remember, we also said not quite long here that some of these menstrual irregularities are actually normal, depending on what happening. A woman, for example, that is perimenopausal and she's having irregular menstrual flow, it is normal. Or a lady that just started the onset of her menstruation and it's less than 3 years and she's having regular menstrual flow, this is actually considered normal. Or a woman that is actually breastfeeding and she's breastfeeding exclusively. She has high level of prolactin and she already has what we call lactational amenorrhea, LAM. That will predispose her to an ovulation where she's not ovulating. And when she's not ovulating, also she have irregular menstrual period. These are some of the things that we'll discuss with them at length so that they will understand the clear terms as gynecologists that look, this irregular menstrual flow you're having, there's nothing to worry about. It's actually normal. And if, on the other hand, we're able to also establish, based on our conversation with them, and we realize that the reason why they are having this irregular menstrual flow is that we request for some investigations. We will let them know that, look, the treatment for this is that we place you on certain pills. And if you use this period for so period of time, you will be fine. You will be normal. There's nothing to worry about. If you have this complaint, just feel free to see your gynecologist, and the gynecologist will explain to you in details. So in other words, menstrual irregularity is never a sign of faults or blame on the part of the woman. It should be seen as an avenue to seek for assistance or help from the gynecologist, where they can explain other things to you in such a way that you would understand the clear term that is never any fault of yours.
Thank you so much, Dr. Ewanowo. Today was, I went back to school. I'm done with childbearing, thank God. But even me, I learned quite a few, because especially when you talk about perimenopausal, yes, as you are getting older, you're like, this thing never finished, So yes, thank you so much for today's free consultation, for your advice, for exhaustive advice and thoughts on irregular periods and when to worry and not to worry. Once again, Dr. Ewanowo is a senior registrar in obstetrics and gynecology at Lagos Island Maternity Hospital. He's also the first vice chairman, Nigeria Medical Association, Lagos State. Thank you so much once again, Dr. Ewanowo, for coming on the show. Enjoy the rest of your day.
Thank you. Welcome, and good morning, Nigerians.
Yes. Radio Doctor on Women Radio WFM 91.7 is Nigeria's first free consultation, specialized radio health program, broadcast Mondays through Fridays at 10 a.m. To join us tomorrow for another edition of Radio Doctor at 10 a.m. Many thanks to the producer Aisha Sani and Gloria Oyeleke at the studio for producing me, and many thanks to the executive producer Tom Okewali Shonaya. My name is Fumi Bangbala. As always, do have a healthy day. Do stick around with our station for more amazing shows and great music to keep you company today. Once again, my name is Fumi Bangwala. Goodbye and God bless.